enterprise, and not, an entertaining enterprise or anything like that, is that it transforms what you're then able to do for patients. I remember that I needed encouragement and coaching when I first started to write about patients. I sort of didn't think that was an acceptable thing to do, to write stories, even making things up. And yet I was at a writing seminar specifically for healthcare professionals. And we all were encouraged to write about our practice, not for publication, but simply to start knowing what it is we knew but didn't realize we knew. And I remember one of the first things I wrote was about a young woman who would come to see me with headaches. And, they were not terribly worrisome headaches, as she told me. And I thought maybe she should take some food. And she had a little iron deficiency anemia, but so do most women who are menstruating, so that was not a very big deal to me. And yet, just the day that I was leaving for this month-long seminar, as I'm gathering up all my papers and sort of making arrangements to be away for a whole month, this young woman was in the waiting room, waiting for me, almost waylaying me, because she needed some papers signed. And they were disability papers. She wanted me to sign a disability form, and I had to put a diagnosis and a sort of certification that she was disabled. Well, I didn't think she was. I knew she had headaches, but I didn't think they were really severe enough to count as a for disability. And I slightly resented that she just come to the waiting room without an appointment and sort of figured that I would make room to do. Anyway, I was in a hurry. I couldn't stop. I couldn't call her into the office and talk to her. And I remember scrawling very quickly something at the bottom of the form that said something about iron deficiency anemia. And I signed my name, and I gave her the form, and I hurried up. I didn't even sit down. And then when I got to this seminar, I felt horrible about that. I felt that I had scornfully covered her, and that I really, I felt ashamed that I had given her such short shrift, and wondered why it was that she thought she needed disability. I was encouraged to write about this, filling in with fiction the gaps that there were in the story itself. And so I did. And I made up what felt like a plausible explanation for the young woman's behavior. And it was outlandish. It was completely made up. She was a young woman, tall, slender, attractive. And so in my story, I completely made this part up, that she wanted to be a fashion model. She wanted to be a model. And her aunt in the city had just met an agent, and the aunt said, "Come, Luz," I gave her a name, move into my apartment in Manhattan. I'm going to put you in touch with the agents I've met. You can get a portfolio together. It'll take a couple of months, but this is a very, very big one. I completely made this up, just on the basis of a few little things I knew about. And so the reason that she wanted the disability was to tie her over in this kind of emergency move to Manhattan. And at the end of the story, she ruminates. It's told from her point of view. At the end of it, she ruminates about how come Dr. Sharon seems so scornful. And so when I got back from the seminar, of course, I was really invested in her because I had spent so much time imagining her interior and imagining her motives and desires. So when I saw her next in the office, it was with deep regard and deep curiosity and, of course, apology for having brushed her off the last time. The point I'm making with this long story is that the writing of it gained me a position nearer to her than I otherwise could have been, because I was very actively and rigorously trying to inhabit her situation. the office, and I just told her simply, sorry I was that I had not had time the last time to speak with her, and I wanted to know about her situation. Well, of course I was all wrong, and I was right. She needed a disability in order to tide her over for a move to America. That part was right. But it was not a move toward a future as a mom. She was 20 or 21. She decided she was old enough that she could move with her sisters from this apartment in Yonkers, where she had been sexually abused by her father and her uncles for many years. And she absolutely refused to stand by and watch her sisters undergo the same ordeal. This is why she needed a disability. So immediately we hooked her up with the domestic violence crisis team. We indeed found a shelter for my patient, her sisters, and the mother who all moved in and out. I became the internist for 2 of her 3 sisters and her mother. And when the father was very ill, I was internist as well. So you see what I mean. There are positions one needs to be in with persons who are suffering who need us. And the, how can I say it? The simple interventions of using one's imagination and writing toward a nearness have profound impact. Now, of course, I could have learned about her pieces at home in other ways. And yet, the development of the sudden investment would have been hard to get to. You see? And so more and more of us are finding that the writing that's done in clinical settings, I understand that this is not done in clinical settings. These have nothing to do with medicine, a lot of them. And yet the kind of writing that you're equipping yourself to do is writing that will very much bear on your practice, which is there, and also your training. Those of you who are writers and who become writers in the course of your training will discover with me that the writing transforms practice. It transforms the training, it transforms the practice. I want to read you some things that some of my students have written along the way, because since our program has been established since 1996, we have quite by now an ambitious program of writing with medical students, doctors, nurses, social workers, chaplains, physical therapists, and even more of our now journalists, oral historians at Columbia. But at the health center, we offer rigorous writing seminars in many settings. I run one for the oncology team, the doctors, nurses, and social workers who work with inpatient patients admitted to hospital for treatment of cancer. We have seminars in the AIDS HIV clinic. We have seminars in the pediatric, neonatal, intensive care unit. All of these different settings, usually high-stress settings, where the doctors and other healthcare professionals require some highly rigorous and reliable methods of understanding very clearly what they themselves are undergoing with their patients and what patients are undergoing. It's not at all unusual for me to say to a social worker or to a resident, I know you don't know very much about what happens for her at home. Make it up. you can make it up, by virtue of making it up, you will learn something very important there. All right? So do you see, I'm standing on its end a little bit, that the ordinary reasons that people might write fiction or poetry or non-fiction essays are for expressive reasons, which are great and fine and important. And this, the kind of writing that people are on the threshold of doing, becomes also perceptive writing, which is to say, the better you are at representing what takes place, the better you are at seeing it. All right? So it becomes a primary, it's almost like it becomes a primary sense. For you all who are writers, do you see what I mean? Your sight and smell and hearing and writing, that it becomes a primary sense by which you can absorb and then understand the world. Yes?